Hi, so my name is Dr. Rohit Gupta and I'm Director of Osteopath Clinic, Gurgaon. And I'm a neurotherapist working with a lot of neuro patients from last 10 years. So I've worked with Apollo and Max Sakit before. And I'm also specialized in chiropractic and osteopathy techniques, which we have been doing with our patients. So let's talk about our patient's Alma Chopra, and she has been suffering from ataxia. So she has lack of coordination in the lower limbs, upper limbs. So she has difficulty in walking and even maintaining the balance in the standing. Now, when we see the other part of her, she has a little bit poor posture in the back, lack of mobility in the back and neck area. So what we are doing is that we are working with mixed techniques. So we are combining PNF approach. PNF stands for proprioceptive neuromuscular facilitation, and that brings stability, that facilitates stability, movements, gait training, walking training, and it works on motor control and motor learning, so that the brain of the patient is going to learn those movements. And we are working on a lot of intramuscular coordination stuff with her. At the same time, we are using some osteopathy techniques, some chiropractic stuff like some mobilization, some manipulations that's going to make her spine better, going to make her spine more mobile. We are working on her posture at the same time. So she's been suffering from ataxia from the age of 13 years, so it's been long for more than 20 years. And I believe that by working with this PNF and the combined osteo and chiro stuff, we're going to make her better in maybe around in next 2 to 3 months. We can bring a lot of changes. Of course, we cannot get to the 100%, but that's what we call in the neuro rehab, getting the patient to the maximum potential, and we are going to take her towards the betterment. So let's hope for that she'll be having more stability in the standing, in the walking, and she'll be having a much better mobility in the spine, good balance in the sitting again, and she'll be able to do. She should be becoming more independent. And we are going to again focus on the activity of daily living. That's again going to help her in doing the stuff like dressing, bathing, so toileting, everything. So the goal is to make her more independent actually, and that's what we are going to focus with the rehab area. So that's what we are working. Thank you. So we have been doing a lot of techniques with her, but here we are showing you 2 or 3 techniques. Like one is the lifting part of the PNF, and one is the osteopathic for the spine mobilization, and once we are showing is for you gait training stuff. So out of 100 techniques which we have been performing with her, here we go. Lifting pattern of the PNF, and I'm going to ask her to come over here. That's a bilateral PNF pattern for the upper limb. When she'll be coming up, that we are going to create a radiation and we are going to reinforce back muscles. So that's going to help her for the back mobility, stability, and the strengthening part and the posture control. So we start from here, and I'm going to ask you to come up, keep coming up, and you have to keep folding your arms with your eyes. Now stay there and try to keep your back straight. Stay, hold against my force. And now if we just look at this back, so we stay there. So the strong resistance here is going to reinforce the upper back and the middle back. Stay there against my force. Stay more, and then down, and then one more time up. Keep coming up. Look up. Stay there against my force. I'm going to give you resistance at the arms and at the head. Stay there against my force. Stay there more. Stay more. Stay more. So any patient with the kyphotic posture or weakness of the upper back, that's going to be stand over here. Stay. Hold that from the opposite hip, and now bring it up towards me. Bring it up. Bring it up. Look at your arm. Stay there. Back straight. Stay there against my force. Now allow me to bring it down. So you still have to resist, but I will force you down. Allow me to bring it down. Allow me to bring it down. So this is eccentric control, and I go up. This is concentric contractions. Stay, static contraction, and allow me to bring it down. And there we go for eccentric. One more time. Go up. Look at your arm. Go up. Stay there. Hold. Allow me to bring it down. We will stop. We're going to work on the osteopathy articulation technique for the upper back mobilization stuff. So I'm just gonna make a move this way, and I'm gonna keep my fingers at the different spinal segments to reinforce the particular segments. So like I can move from the lower cervical thoracic junction, middle upper back, I can reinforce middle back, and I can go even down to the lower back. I can use this hypothenar eminence as well, and I can just make a move. And that's going to give a lot of mobility to the spine. Nice. With the PNF guided resisted walking training program, I'm going to put both the hands on the hip area, and I'm going to ask you to take a big steps against my force. So take your right leg forward, and then the left, and then the right, and then the left, and then right, approximation, 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 and approximation, approximation. So this is to improve stability on the right side, this transverse training. Left leg forward and approximation, 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 approximation. Keep going, keep going, keep going, keep going, keep going.